Have you ever wondered what ADHD really is? ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects millions of children and adults worldwide. It's characterized by three main types: combined, where symptoms of inattention and hyperactivity impulsivity are both present; predominantly inattentive, characterized mainly by symptoms of inattention; and predominantly hyperactive impulsive, where hyperactivity impulsivity symptoms are most prevalent. So let's delve into the world of ADHD and understand more about it. ADHD affects 5 to 12% of school-aged children, but how does it come about? You might be surprised to know that ADHD is more prevalent in boys, with a ratio of 4 to 1 compared to girls. However, it's important to consider that girls may be underdiagnosed, as their symptoms often manifest as inattention and distractibility, while boys tend to display more impulsive and hyperactive symptoms. So what causes ADHD? Genetics play a crucial role, with dopamine candidate genes and a catecholamine neuroanatomical hypothesis being key factors. Cognitive aspects such as developmental disabilities, inhibitory control, and other errors of executive function are also significant contributors. Additionally, alterations in the sensory system filters, a factor under the umbrella of arousal, are implicated in the etiology of ADHD. Understanding the causes of ADHD is just the first step in dealing with this disorder. So, how is ADHD diagnosed and what are its symptoms? Let's start with the diagnosis. ADHD is not something that can be diagnosed from a simple checkup. It requires a comprehensive evaluation that takes into account various factors. The symptoms need to be observed in multiple settings like home, school, or workplace, and must persist for at least 6 months. The onset typically occurs before the age of 7. It's also important to note that the symptoms should not be exclusively occurring during the course of another psychiatric disorder. There are 3 subtypes of ADHD: combined type, predominantly inattentive type, and predominantly hyperactive impulsive type. The combined type is diagnosed when there are 6 or more symptoms of inattention and hyperactivity impulsivity. The predominantly inattentive type is diagnosed with 6 or more symptoms of inattention, and the predominantly hyperactive impulsive type is diagnosed with 6 or more symptoms of hyperactivity impulsivity. Now let's talk about the symptoms. The core symptoms of ADHD, according to the DSM-4, are inattention, hyperactivity, and impulsivity. Inattention can manifest as careless mistakes, inability to sustain attention, and forgetfulness. Hyperactivity can show as excessive fidgeting, running, or talking. Impulsivity might be seen as blurting out answers prematurely or interrupting others. Recognizing these symptoms is crucial for a timely diagnosis and intervention. Once diagnosed, how can ADHD be managed? The answer to this question lies in a combination of non-pharmacological and pharmacological approaches. When it comes to non-pharmacological strategies, they encompass parent management, anger control strategies, positive reinforcement, and social skills training. There is a place for individual and family therapy, resource room, tutors, and classroom intervention. It's also beneficial to incorporate regular exercise routines and healthy extracurricular activities. On the pharmacological front, standard treatments include stimulants such as methylphenidates and amphetamines. There's also a non-stimulant option, a type of drug called SNRI, specifically atomoxetine. For those dealing with comorbid symptoms, antidepressants and antipsychotics may be recommended. Remember, every individual's journey with ADHD is unique, and so should be the treatment approach. It's crucial for healthcare professionals, educators, and families to work together to devise a tailored plan that suits the individual's needs. With the right treatment, individuals with ADHD can lead fulfilling lives. So, what does the future hold for someone diagnosed with ADHD? The prognosis for ADHD can vary greatly from person to person, and much of it depends on the timing of diagnosis and the effectiveness of treatment. Studies show that around 65% of children diagnosed with ADHD continue to experience symptoms into adulthood. Furthermore, 70 to 80% of individuals with ADHD continue to exhibit symptoms into adolescence, though hyperactive symptoms usually abate over time. It's crucial to understand that ADHD isn't a life sentence. It's a condition that can be managed effectively with the right support and therapies. Early diagnosis and treatment can significantly improve the quality of life for individuals with ADHD, helping them to manage their symptoms and excel in their personal and professional lives. Remember, ADHD is a journey, not a destination. With understanding and support, individuals with ADHD can thrive. That's it for our comprehensive guide on ADHD. We hope this video has shed light on the condition and given you a better understanding of what it entails. If you found this video helpful and want to see more content like this, please consider subscribing to Medicine Health 360. Your support means the world to us, so don't forget to give this video a thumbs up. We'd also love to hear your thoughts and feedback on this topic, so please leave a comment below. Remember, your health is your wealth. Thank you for watching, and we look forward to seeing you in our next video.